common question that patients come in with is, should I ice my foot and apply cold, or should I apply heat, and what are the benefits? So oftentimes what we mainly recommend is to apply heat, and the reason is that heat vasodilates your blood vessels. So when you look at the foot and you think of all the different foot ailments, heat ends up vasodilating, and what that does is it increases circulation to the foot and can increase your immune system's ability to bring connective tissue precursors to an area to promote healing. And a lot of times when people ice their foot, vasoconstriction of the blood vessel happens, and people experience a short-term relief in pain or short-term relief of whatever is ailing them, and that is mainly due to the vasoconstriction decreasing blood flow and possibly numbing an area. And so in the short term that can be beneficial, but really in the long term what we want to do is to be able to increase blood flow, promote vasodilation, so that your body can send the connective tissue precursors to heal an area, or if there's inflammation, that can just be able to, your body can circulate that out and process that. So what is heat good for? So if anyone has any degeneration, joint issues, that can promote healing and can sometimes help with pain. Plantar fascial pain can benefit from having circulation increase to the area. And if you want to reference a research article that we have posted on our website that talks about plantar fascial pain and how it's circulatory in nature and not inflammatory in nature, you can go ahead and log on to the website and look at that article. Neuromas, also they benefit well from vasodilation and heat. So nerves respond really, really well to heat. And you can see this even in the way that conventionally, like complex regional pain syndrome that people experience, a lot of the pharmaceuticals that are prescribed are pharmaceuticals that vasodilate, and some patients experience relief of nerve type pain from that. And so we're just vasodilating by simply having someone soak their feet in water. So the ways that you can do this are you can either soak your foot in warm water, you can add Epsom salt to that, and the reason is Epsom salt has magnesium in it, and magnesium can relax muscles. So you can apply half a cup of Epsom salt to 8 cups of warm water and soak your feet for 15 to 20 minutes. Or you can do an alternating hot and cold foot soak. So you can soak your feet in hot water for 3 minutes, and then soak your feet in cold water for a minute, alternating that 3 cycles, ending on cold. And you might think, well, why am I doing hot and cold when you just told me cold vasodilates? Well, the heat initially vasodilates, or the cold vasoconstricts is what I meant to say. So heat vasodilates and cold vasoconstricts, but when you end on cold, it makes this connection with your brain when your brain thinks that this area is cold in your feet, and so it sends circulation down there. And so really we are promoting circulation by even doing alternating hot and cold. And for people who've experienced fractures or any broken bones, this is really beneficial also to promote healing and circulation and get those connective tissue precursors and bone precursors there. If you are in a cast or if you have a boot and you are unable to soak your foot, you can always soak the opposite foot in doing that alternating hot and cold contrast. So if you broke your left foot, you can soak your right foot. And the way that your body works with the way that nerves branch out is that your body will receive the benefit of that vasodilation and vasoconstriction and ultimately increase circulation if you just soak the one limb. Okay, so some contraindications for heat could be possibly numbness, any sort of neuropathy, where someone is not able to sense heat, cold, or touch. And so in that sense, you wouldn't want to soak your feet in alternating hot and cold or hot water because you wouldn't be sure what the temperature was and you want to prevent any burning or any sort of other injury to your skin or to your foot. Some indications for cold The reasons why we would recommend that is if someone had some sort of acute injury, and it would really be within the first 10 to 20 minutes, just to really help alleviate and manage pain in the short term, and maybe pare down any inflammation while someone's getting transported to see a physician. But other than that, we are really looking at the long-term picture, and we really want to promote healing and circulation by applying heat or that alternating hot and cold.